in 2019, when the whole pandemic of COVID-19 hit the world, it actually cut a swath across the globe. However, the most impacted countries were the ones with poorly resourced healthcare system, and unfortunately Pakistan is one of those countries. This whole funding, which is the World Bank, HEC, higher education development funds, they came right in time in order to answer these questions and in order to fill the gaps in the understanding of the biology of infection, and that's where people like myself, who are infectious disease researcher, come into play. At that particular time, the most important and the burning question was the biological basis or the biology behind the remarkable diversity of this infection. So there were three groups of people that were being observed. One of them, or the three groups of infections that were being observed, one of them was severe infections. So there were people who were infected, but they didn't even know that they were infected because they didn't have any symptoms. So there was no need to either treat them or to isolate them, or they were not isolated. And I think these were the people who are actually transmitting the infections because they don't know that they were infected. Me and my group wanted to see if there is an immunologic basis to this diversity or there is a genetic basis to this diversity. We also found that there was some genetic predisposition to this infection. So people who were of a certain genotype were more susceptible to this infection as compared to people who were of a different genotype. So there were two fields that we sampled. We are still sampling those people in Dataganj, Paksh and Gulberg. And by collecting all of that information, we were able to develop patterns and trends of infection. And that helped us understand how this infection was transmitted within communities and across communities. The team that I worked with had postdoctoral fellows, research assistants, but above all of this qualification, one thing that was common in all of them was the vigor. It was the drive to do something. And I think that is what got us through this pandemic and got us through this project. We were all on the same page. We were motivated to actually do something and produce something and get some good results out of this grant, that we were able to produce a lot of stuff that was applicable, in both academia as well as in policies.